we have Dr. Polsky with us now. Dr. Polsky, the floor is yours.
Good morning, gentlemen.
Good
morning. Farmers market's a wonderful opportunity to eat healthy and support our local agriculture. Our case counts over the past week, unfortunately, have risen back up a little bit. We did have some incremental decrease the previous 2 weeks, and then this past week, I'm going to flip the side, primarily due to a rise in infections in children and teens, as well as adults 36 to 55. All the reduction that we saw the previous 2 weeks, we saw the numbers go right back up just a little bit above the previous baseline. So take a look at numbers. We're still seeing about 2,000 people each week getting tested. We had 151 confirmed positive cases with a positivity rate of 7.3%. When we take a look at deaths and hospitalizations, and these are statewide, which gives a better picture when you look at a small county, the numbers fluctuate a lot, that we're still seeing a significant number of deaths, so close to 100 deaths per week, or to put it in another term, we're seeing one Marylander die every 2 hours at this point, and that is in part because of the infection rate, in part because of the variants being more severe in terms of illness. And so locally in our hospital, we have people ranging from their mid-30s to their mid-80s hospitalized right now. We have a half dozen people inpatient at the moment. Fortunately, we are seeing a continued increase in the number of people locally and statewide who are getting vaccinated. The numbers up on this chart are a portion of the entire population, so it includes those under 16 who are not eligible for vaccination. If you take a look just at those who are eligible, Calvert County has now crossed the 50% threshold, so now 53% of those 18 and over have received at least one dose of the vaccine. We are now slightly trailing the state, and we've talked before that is likely in large part because we were getting relatively small numbers of vaccine locally. This week, we are receiving, in conjunction with the hospital, a shipment of Pfizer vaccine that does two really important things. One, it increases the number of doses that we have locally, and the second is that now 16 and 17-year-olds can be vaccinated with Pfizer. So we've already begun discussions with the schools, and in particular sports teams, where we have seen a significant number of cases and outbreaks. We're also talking to rec leagues. Dr. Folsom is here with me today, and she has been doing yeoman's work, connecting not only with the schools and rec leagues, travel teams, and the high school teams, but also working with the Chamber of Commerce and Kathy Manny. And we've been working with various business sectors to try to increase the amount of vaccination taking place. When we take a look at 65 plus, I mentioned before that really we're doing a phenomenal job locally. Frederick County had slipped by us into second place last week, and then we have moved past Frederick back into second place again. So out of all the counties, despite not having the same number of doses that they're getting in other areas, 85% of seniors in Calvert County have now gotten at least one dose, and 75% have completed their vaccination series. Certainly our local hospitalization rates would look much worse if it hadn't been for this tremendous effort, and we're hoping that the remaining 15% of seniors will end up getting vaccinated pretty shortly. So taking a look at where people are getting vaccinated, you can see that the health department has provided the majority of the doses, but not to underscore the importance of both the hospital staff, local pharmacies, and then you can see outside of the county, getting into smaller numbers, we are starting to see a bit of an increase in people going over to Charles County to the mass vac site over at Regency Stadium, but still a relatively low number compared to the total. I do want to mention that the state just opened up another mass vac site in Anne Arundel at the Navy Stadium. So for people in the north part of the county, that might be a reasonably accessible. But at the moment, we have, again, a greater supply in the county, and I'm not sure that as many people will need to leave the county over this next week or two to get vaccinated. So taking a look, again, at all the places across the county where people can get vaccinated, and I included this week some of the private medical providers who now have vaccine. I will say that they have a limited number each week. For Calvert Internal, as an example, they're only getting 300 doses a week from the state. They have over 10,000 patients who have yet to be vaccinated. So for people who get their care at those providers, it may be feasible for you to get your vaccine at your doctor's office, but at this point, that's going to be very limited, so people should not delay. If they can't get their vaccine directly through their family doctor, then they should reach out to the health department, to county government, or to go to one of the mass vac sites or a local pharmacy. One thing that is new since we talked last, want to mention that I highlighted on there that now that we have a better supply of vaccine, we are making enrollment for vaccines immediate. There's no longer going to be the need to go on a registry. So if someone today wants to get a vaccine today, we are at our drive-through site, we're doing vaccinations. I highlighted that people can go to the website calvertcountycovid19.com. That's the health department's COVID-specific website. And you can register directly, pick a time, get your appointment, and then just drive over to the site and get vaccinated. We've also talked to our county government employees who have been really working very hard to help people get appointments. For those that do not have the ability to register online, that they can call the 410-535-0218 number, and county government staff will now help people enroll immediately. So again, no more getting on a registry and then waiting for someone to get back to you, that the county staff will be able to immediately schedule an appointment, and then that person can go ahead and get vaccinated. So I think both of these are a tremendous plus. We wish we could have done it earlier, but we just did not have the vaccine supply to allow that, and we're hoping we can continue this. Now, I will say today is the first day that we are putting this into action. So like anything that has to do with technology, hopefully it'll work smoothly, but there may be a few days of transition. So if anybody goes on the website, has some frustrations or problems, just one of two things: either call the number to have someone help them, or maybe give about an hour, go back on, and hopefully things will be working a little bit more smoothly. And I did want to just talk briefly about the Johnson & Johnson vaccine. I know that certainly has been in the news over the past 2 weeks. As most people know, the FDA put a temporary hold on the use of the Johnson & Johnson vaccine about 2 weeks ago because of a report of a small number of blood clots, but their blood clots were very serious and could potentially be life-threatening. And so they paused while they took a look and made sure they had all the evidence they needed before making a decision. The FDA met again on Friday, and at that point, after examining the evidence, decided that the safety of the vaccine was still extremely good, and clearly the benefit to the vaccine is there, and so they took the hold off, and the vaccine is available again. Now, in a little bit more nuanced way, so I'm going to speak as if I was counseling one of my patients, that all of the blood clots, which is a total nationwide of 8 million doses, with 15 blood clots, so less than 1 out of every 500,000 people vaccinated, those blood clots all occurred in women, and 13 of the 15 occurred in women under age 50. So the concern is really if in the age group of women between ages 18 and 50, for those women over 50, the risk of a blood clot was less than 1 in a million, so they saw 2 blood clots in that entire group. So for men and for women over 50, I see no issue if someone chooses to get the Johnson & Johnson. The advantage there being it's a 1 dose. With the Moderna and Pfizer, it's 2. So for people who'd want to get a single dose, then I see absolutely zero issue for women over 50 and for men. For women under 50, I think it's a decision to make. And again, that risk of blood clot is very, very small. If you just look at that group, the risk of getting a blood clot is about 1 in 140,000. So still, we're talking very, very small. The risk of ending up with COVID, and let's take women in their 20s, statewide to this point, we've seen 39 deaths in people in their 20s. If you take a look just at women, the risk of dying from COVID to this point has been 1 in 20,000. So I think that most people just look at, for somebody that age, there's really no risk. The worst is you don't feel good. So the risk of dying from COVID is 1 in 20,000. The risk of getting a blood clot, not a fatal blood clot necessarily, but a serious blood clot, is 1 in 140,000, or to put it another way, you're 7 times more likely to die from COVID if you're a woman in your 20s than you are to get a blood clot from that vaccine. With that having been said, the Moderna and Pfizer vaccines have shown no blood clots after we're up to about 400 million doses in this country. So if I was counseling my patient, I would say that if the Moderna or Pfizer is available and you're female and you're under 50, then that takes away that risk, and that would be my choice. For someone who, for personal reasons, would want to get a single dose, I think the risk, again, is so small of a blood clot that it is in someone's best interest to protect their health, protect the health of their family members, to go ahead and get Johnson & Johnson, regardless of age. And again, for women over 50 and men, I don't think there's really any issue, and it's just personal preference at that point. And I will remind, as I have every time, for anyone who is concerned because of rumors they hear on the internet or whatever personal concerns that they have, please speak to your personal healthcare provider, your physician, your nurse practitioner. I do not know of a single doctor or nurse practitioner in our county who says anything other than people should get vaccinated.
So, Doc, you remember last time we had a discussion of basically here we're having this global health crisis, but there's no narrative about being healthy. So I was reading, and I read this. I thought you found this curious. I'm sure you know this. It says CDC study finds about 78% of the people hospitalized for COVID were overweight or obese. Why is that such a hard narrative to get out to people? Why isn't this country pushing, hey, look, the healthier you are, whether you get cancer or anything else, the healthier and the stronger your body is, the better shot you got.
Right.
But we're spending all this media focus on shot, 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 shot. Are we that lazy of a country that we just want something bottled up, that we don't have to worry about anything else that we do and how we take care of ourselves? I don't understand why there's not this push that, hey, here's another reason. Take care of yourself. Eat the best you can. Move a little bit at least. I don't understand where that's getting lost. I mean, all that you turn on TV for is, hey, all I need to worry about is getting a shot and it takes care of everything in life. And I just don't think it's that simple.
Well, certainly both are important. And in the short term, if someone is 50, 60 pounds overweight, they're not going to lose enough weight to reduce the risk for the problem we're dealing with right now for COVID, because they could end up getting infected a month from now. For the long term, both to reduce risk of infectious disease, and it's not just COVID.
Sure, I think high blood pressure, diabetes, all these other things.
Right. We look at cancer risks and all the things that people know. And one of the pushes to the health department that we made back last spring and summer is that we knew that when fall, winter rolled around, we would see an increase in cases. Really work with your patients who are diabetic, have blood pressure problems, get things under the best control you can now before we get into fall and winter. But we also know how difficult it is for people in this country to start to move their health in a better direction. And it was prior to COVID.
Sure, it's been an ongoing problem. I remember so many administrations have had, remember they used to bring Schwarzenegger in to talk to the country about lifting weights. But this is a perfect opportunity, a perfect venue. The money is being spent, the trillions of dollars being spent. Why are we not starting programs off in school about eating right and nutritional value and mandatory physical movement? That's just as important as learning something else. I mean, if your body's no good, I just don't understand where that discussion is. It's the perfect venue for me, I would think, to get that going.
And the health department and the hospital, we are working with primary care providers, with diabetes initiatives, get more people into, and it does take education. We live in a society where there is a clear financial incentive by a lot of corporations to sell you stuff that is not good for you, is going to end up making you unhealthy in lots of different ways. And of course, I'll pull my phone out. I mean, how many people just, when you're sitting there like this, you're not out exercising,
right,
you're not out there, being active.
And you know yourself, Doc, there's not a person walking the earth hasn't heard of COVID now. Not a person.
Right.
But how many people truly know how to eat right and know how much exercise is needed? I mean, all these things, no talk of that. It's just, well, go get a shot and go back to eating 20 cheeseburgers and sitting on the couch and you'll be okay.
Well, I hope that's not the message.
But I mean, it just, we just live in this just 2-second society where well, I know it's a little inconvenient, but make sure you pull up and we'll get that, and then you go right back to normal. Instead of the building blocks, when I was a kid, there was tests in school. How many push-ups? How many pull-ups? And now seems like it's offensive to say, hey, there's nothing wrong with trying to get people as healthy as possible. There is nothing wrong with that. But that's lost in the whole thing. It's all we're hearing is these big major companies are coming to the rescue. How about putting some salad mix, on the thing? You know what I mean? So, a treadmill, anything. I mean, my God, is it that much to ask with the trillions of dollars to not take just a small percentage to start educating people? Hey, okay, we're dealing with this today, but what's coming tomorrow? And for whatever's coming tomorrow, be as healthy as possible so that help your body help you.
Right.
I just don't get it.
I agree with you 100%. And public health has been arguing for years that we are starved for funding. You can't make money off of helping people be healthy.
You couldn't have got $3 2 years ago for something like that. Now you wave the COVID flag and a checkbook comes.
Well, and I have been pleading both at state level and federal level that we end up with sustainable money that we can do things just like what you're talking about.
Right, because you can't just do it today.
Right, we get a flood of money just to deal with COVID, and then a year from now, everything evaporates and we're right back where we were before.
Exactly.
Yeah.
I think I just realized today that Commissioner Hart is the Dr. Oz of Calvert County. You done, Commissioner Hart?
Oh, yes, sir. Yes,
okay.
Sir.
The drive-through, is it open every day during the week now, or what?
It will be contingent on the doses we get. So we still don't have enough doses to have it open every day.
Right.
And we also do second doses some days. So this week, the drive-through is open 4 days out of the week. That's the most we have right now. And honestly, we're reserving some because we're working with the schools. You probably have heard that University of Maryland and a lot of private colleges are now going to mandate vaccination before anybody can walk on campus coming this fall. So we want to make sure, because the Pfizer doses are the only ones for the 17-year-olds who are going to be going to college. Those are the only ones that are approved. We want to make sure that, because this may be the last batch of Pfizer we get for who knows how long, we want to make sure that we reserve some for those who really need this vaccine. So we are kind of walling off a few. But our expectation is this week, next week, and hopefully the week after, that we can at least maintain 4 days of vaccination a week. We were down to 2 days a week with the number of vaccines we were getting previously.
Doc, is there any talk of what this shot for young women as far as in the future? Is there? I don't know how you study. A lot of these women have not had an opportunity to have children, families like this. Mandatory to go into a college. And I'm not on either side. I'm just saying mandatory. They say, well, okay, decision I make 19 to go to college. Is this going to harm me in the future? I'm sure there's worry and concern like that. Is there any verbiage in the medical community about how it's impossible for that to happen or anything like that?
That's correct. There's no impact on fertility from any vaccine, and certainly, we know how COVID vaccine protects people. We know how it builds immunity. It has no impact at all on fertility, either for women or for men. It doesn't affect sperm count. It doesn't affect ovulation. And really, you look at the opposite. When people get really sick, that impacts fertility. And inflammation processes, in women in particular, it can impact fallopian tubes. Certainly, ovulation process can be impacted. So the healthier somebody stays, the more likely when they are ready to have a child that they will be able to. So as an OBGYN...
I was going to say, that's your wheelhouse. Right. That's why I'm asking.
As an OBGYN, without a doubt, and the American College of Obstetricians and Gynecologists, the American Society of Reproductive Medicine, so those are the fertility, the experts in the fertility field have all strongly recommended that their patients get vaccinated.
So they see nothing in there that could be birth defects, nothing like that. They see nothing in there.
Absolutely correct. Yes, and so I know there's a lot of rumors that go flying around, but there's absolutely no truth to those. And apparently the fertility impact rumor was started by some guy in England named Zed Phoenix. Now, I'm not sure who I would limit taking my medical advice from, but some guy who goes by the name of Zed Phoenix and shows up on YouTube is not at the top of my list to get medical advice. And people, I think, really, again, should reflect back that it's way too easy for anybody to throw stuff out there, and then it just kind of catches on. And I get back.
You mean
again
everything
to,
on Facebook isn't true?
yeah,
Newsflash.
and people are making decisions that they impact not just their health, but potentially their lives or the lives of people around them. They should be, I'm not here to force anybody to get a vaccine. But it's important to me as a physician and as a public health practitioner that people should be making informed decisions. And you cannot make an informed decision if you don't have good information. And so people should talk, again, if they're hesitant, they should talk to their doctor, they should talk to the nurse practitioner, get good information, not just what floats around on a website.
So for anybody looking for Pfizer, they can go. There are other sources besides the Calvert County Health Department, because I do know the Wise Pharmacy in Lusby, they've been giving out Pfizer vaccines.
Well, I thought they said you were going to have to get a third Pfizer shot now in 12 months. Is that true?
So there was the CEO of Pfizer went in front of the cameras one day and was talking about this, that, and the other, and mentioned the third dose. At this point, there's no reason to think that there will be a need for a third dose. I think that we all expect that because of the variants, that there will likely become a point where a booster or a supplemental, that would probably be a better way to say that than a booster, because a booster implies that it's the same strain, you're just upping your immunity, that when different variants, and the Brazilian variant is the one that we're really keeping our eye on right now, because the UK variant, the New York variants, the California variants, those all, and the South African, those are all still being controlled really well with the vaccines we have right now, but the Brazilian variant isn't. Right now, the levels of transmission of the Brazilian variant in the U.S. is still very, very low. If that should change, then we know that a supplemental vaccine that would cover that variant would be important. So again, I think it was kind of sloppy language that the CEO of Pfizer used, but at the moment, there's absolutely no sign that the immunity from any of the vaccines we have right now is wearing off. It will eventually, but I've said before. Yes, Commissioner Hutchins.
Doctor, that you've covered a lot of different things, very complex, but the bottom line is, if you would reiterate, get a vaccine, continue to practice the safe practices that CDC has proffered, and will continue to progress through this.
Absolutely.
Right.
So when you're ready to retire from your current job, we're happy to have you come over and work with us at the health department. So yeah.
I'm just a dumb farmer, but
Tim
I've already
retired?
figured out
I don't think so.
it's going to be like a flu shot.
Yeah.
And it may be. And
It's going to turn out like a flu shot, and every year you're going to have to
I'd
get a
be
shot.
better off finding a revolution somewhere to take part in.
I think you're going for your 15th pension right now or something.
I think we've all learned that you can only predict so much
Yep.
with the way things unfold. And certainly speculating what we might or might not need to do 6 months or so from now, it's a fool's errand. The important part is we keep ourselves healthy, we keep ourselves safe now, and we continue to adjust as the virus shifts and as science continues to learn more and more.
Right.
Are there going to be any long-term complications from these shots? Has there been any research done on that by any chance?
To this point, other than those rare blood clots with Johnson & Johnson vaccine, we have not seen any problems. I was going to put in a few slides about, because Commissioner Hance brought up last time about rumors about changing DNA. It can't change DNA. I'll pull those slides back out because I want to talk about the Johnson & Johnson vaccine.
Okay.
But no, this is, and especially the mRNA vaccines, I think that they are the wave of the future for vaccines in general, that they're extraordinarily safe. They are easy compared to previous vaccines. They are much, much easier to shift when we see, and I think flu vaccines will be revolutionized and others. So I hesitate to use the phrase, but I will use it in this instance. Really a miracle of medicine, a miracle of science, that we have vaccines that have been gotten out to people who need it so quickly, so safely, and so effectively. We still have not had anyone hospitalized who has completed their vaccine series locally. I can't speak for everywhere. There might be an exception. But the people that we're seeing in the hospital for various reasons either weren't able to or delayed getting vaccinated. All of my family have been vaccinated. I can't emphasize enough how important it is for people's individual health and how important it is as a humane gesture to others, that you don't want to be the vector of transmission that could cause somebody else to get very sick. And I just want to finish up by saying that the next 2 Tuesdays I'm not going to be here, but Dr. Folsom will be doing a guest appearance. So please be nice. I know you're always on
Please
your
be
best behavior.
nice. I thought we were nice.
You-
I'll say one plug. I know Calvert County Parks and Rec is getting ready to come on probably later, but we are having a walking challenge, the Health Department and Calvert County Parks and Rec. So much to your point, I think it's a really important time for us to get moving, to get people healthier, and that's kind of what we're there for, and that's what we're all about. So please have people join the walking challenge.
Thank you. We look forward to seeing you.
Yes.
We may not invite him back. Just saying.
It may be my Wally Pipp moment. And
Right.
For any non-baseball fans, that was the first baseman for the Yankees who missed a few games. Lou Gehrig took over, and then that was the last you ever heard of Wally Pipp.
Yep.
So,
At least you're prepared. Thank you, Dr.
Thank
Polsky.
you. Thank you
Have
all.
a great day.
Thank you.